Today I'm going to address one of the very common questions asked to me. Is IVF a painful procedure? Will I get pain? I think it's very important to reassure the patient. IVF, what we do in IVF, we give the patient injections so that she can prepare between 10 to 12 eggs. Then after those injections and the eggs are ready, we do a egg pickup, meaning we admit you into Leelavati Hospital or any of my other clinics. Then we give you general anesthesia and put in a needle through the vagina and remove all the eggs out. And then after a couple of hours, you go home. So where is the pain? That is what I want to tell you. So the pain, of course, is in the injections. But there is a way to overcome that pain also. Today, there are injections the needle is as thin as the hair. So those are very painless injections. But of course, they are expensive injections. So if you want to take the injections which are less expensive, then you can rub ice on your skin before taking the injection. This will definitely make the pain much lesser of the injections. Then the second pain is when we do a transvaginal sonography. So we do the internal sonography. A few girls are not comfortable with the internal sonography. So in those patients who have a lot of pain or who get infection after internal sonography, we do abdominal sonography, that is sonography from above the stomach. But of course, those who do internal sonography, we do use lubrication so that the pain is minimized. And actually it's not pain, it's discomfort. It's just that Indian women are not used to this kind of discomfort. The third point of pain which you may anticipate is what patients tell me, how will you remove the eggs? Will we get pain during that process? But you must remember that you are knocked out completely. There is general anesthesia, so you don't feel the procedure at all. And even after the procedure, a painkiller is given. But really, even if painkiller is not given, the pain is absolutely minimal. But pain relief is given in the form of paracetamol, diclofenac, etc. So you don't have to worry about the pain at all. Then of course, is there pain during embryo transfer? Embryo transfer is done without anesthesia, remember that. But it's a very gentle process. We try and do it as gently, as beautifully as possible so that you don't get any pain. So during embryo transfer, there is very little pain. Of course, the only lubrication that we use when we use the instruments is normal saline, because anything else can be toxic for the embryo. So definitely we use normal saline. So I think beyond this, there is not really much pain associated with IVF. Of course, injections after the treatment. Now there are injections which we give after the treatment. Now again, the same process which I told you, you can use ice before giving yourself an injection. And some of them are really oily injections. In a lot of patients, I avoid that. Some patients don't like to insert tablets vaginally. In those patients, I give oral medications and they're very happy with it. All in all, what we try to do is make the experience of IVF very patient-friendly so that you're comfortable and you don't associate pain with the IVF cycle.